What distinguishes osteomalacia from other bone diseases? Imagine bones that are supposed to be strong and hard but instead become soft and bendy. That's what happens in osteomalacia, a condition where bones don't mineralize properly. And like other bone diseases, osteomalacia is mainly caused by a problem with how bones absorb or process vitamin D, calcium, or phosphate. These minerals are essential for making bones hard and durable. When there's a deficiency or a problem with their metabolism, new bone tissue remains unmineralized or poorly mineralized. This results in bones that are soft and more likely to bend, crack, or fracture, even with minor injuries. Now compare this to osteoporosis. Osteoporosis involves a different problem. In osteoporosis, bones lose density and become porous, but the mineralization process remains normal. The bones are still properly mineralized but are simply fewer in number and less dense overall. This makes bones fragile and more prone to fractures, especially in the hips, spine, and wrists. Osteoporosis often develops with age, hormonal changes like menopause, or poor nutrition, and it usually doesn't cause symptoms until a fracture happens. One of the key signs that set osteomalacia apart is the presence of soft bones caused by defective mineralization. Symptoms often include bone pain, especially in the hips, lower back, and legs, along with muscle weakness. Fractures can occur from minimal trauma because the bones are so weak. Blood tests often show low vitamin D levels, normal or low calcium and phosphate, and elevated parathyroid hormone levels, which try to compensate for the mineral deficiency. On X-rays, doctors might see looser zones or pseudo-fractures, which are characteristic of osteomalacia. In children, a similar condition called rickets involves defective mineralization of growth plates, leading to bowed legs and other deformities. In contrast, osteoporosis does not involve defective mineralization. Instead, it's about losing bone mass and density, making bones more porous and fragile. It's often silent until a fracture occurs. Risk factors include aging, hormonal changes, smoking, and poor diet. Treatment for osteoporosis aims to slow bone loss and increase bone density using medications, lifestyle changes, and addressing hormonal factors. It's important to note that sometimes osteomalacia and osteoporosis can occur together. Osteomalacia can cause secondary osteoporosis because weak, soft bones are more prone to loss of density over time. But their causes and treatments are different. Osteomalacia needs correction of vitamin D and mineral deficiencies to restore proper mineralization. Osteoporosis treatment focuses on preventing further bone loss and strengthening bones. Understanding these differences is especially important for those with osteoporosis because, although both conditions weaken bones, their causes and treatments are distinct. Osteomalacia's root is nutritional and metabolic, requiring correction of deficiencies, while osteoporosis involves managing bone density loss. Recognizing these differences helps doctors choose the right treatment plan and improve bone health effectively. In summary, osteomalacia is distinguished by its fundamental problem with bone mineralization caused by vitamin D and mineral deficiencies, leading to soft bones. Diseases like osteoporosis involve loss of bone mass and structure but with normally mineralized bones. This knowledge guides proper diagnosis, treatment, and prevention of these related but separate bone conditions. Always consult healthcare professionals for personalized advice and management.